licensed acupuncture herbalist. Today we like to talk about what is the optimal level of blood pressure. With so many people having high blood pressure and taking blood pressure medication, we try to optimize the blood pressure. If it's too low, it can be linked with increased risk of stroke and dizziness. If it's too high, then it can also cause heart problem and kidney problems. And do you have blood pressure medication before?
Yes, 10 years ago or so, my cardiologist diagnosed me with high blood pressure, not acute high blood pressure, but high blood pressure. And he prescribed lisinopril at a 20 milligram level. Well, when I would see him once a year, he would notice my blood pressure was getting lower and lower, which means that the medication was working, but it would lower it too much. So we cut the dosage down to 10 milligrams. It continued to go low, and you suggested, and he agreed, to cut the 10 milligrams in half and take 5 milligrams every other day. It still went low, and when I say low, I'm talking 90, 92, over 57, 56, which is too low. I was always complaining about dizziness, and I linked it to the use of lisinopril and my blood pressure going too low. So I discontinued it, and now my blood pressure is at a level stage of maybe 130 over 74.
Yes, according the new standard recommended by American Heart Association, people who above 80 or around 80 years old, if they are taking blood pressure medication, and the ideal blood pressure would be around 130 over 70-ish. And if it's below 120, the systolic, and the diastolic one, the lower one, is below 60, then there is increased risk of stroke. Because when the blood pressure is going too low, then you don't have sufficient blood flow to the brain, to your heart, to your hand and feet. So according to a study in Stroke 2022, the journal Stroke, they did a study for veterans, and there are over 20,000 veterans joined the study. It is a retrospective cohort study and measuring blood pressure and increase the risk of stroke. And they find people who constantly had blood pressure below 120, and the lower one is below 60, they have increased mortality rate of stroke. So optimize the blood pressure is actually can helping good circulation to brain, so to prevent the stroke, dementia. And if you think about the small blood vessel, if they don't have good blood flow, they're going to gradually close, and the brain area which are nourished by blood vessel, that will be gradually damaged, and the nerve cells will be damaged. Thinking about when you shut down the blood flow completely to your brain, I think that's around 5 minutes, then the brain cell will die. But the small blood vessel will only influence the small area, and then, but that accumulating. So if chronically there's a low blood pressure and there's no sufficient blood flow to the brain, then gradually, slowly, you're gonna lose the nerve cell function. That's one of the reasons my mother got dementia. She had been taking blood pressure medication for over 40 years, and during the summertime, because the weather, the increased the temperature, all the blood vessels dilate the hand and the feet in order to optimize your body temperature. And my mother always cut half the medication. so that her blood pressure will not drop too low. But when she was in a nursing home, and they required, they thought the blood pressure below 120 will be ideal for older people. My mother was 80 years old back to that time, and she already had multiple stroke. So the blood pressure below 120 every single day, sometimes it's below 100. I can see she was lethargic, she was very tired, and she has no response to the questions I ask. And then gradually the dementia get worse and worse, and she got a multiple small stroke. Eventually, she couldn't swallow, she couldn't breathe, and she died at the age of 84. So that's why I pay attention to low blood pressure, because personally, I had a low blood pressure when I was young, but after menopause, the blood pressure can go up high or can go low. That's why I measure that 3 times a day. And recently, you stopped taking the lisinopril, right?
Not taking it at all. My doctor told me to continue to monitor my blood pressure, but if it's in normal levels, not to use the lisinopril anymore, because it would lower it too much, where I would feel dizzy and tired.
You didn't have dizziness recently, right? The lightheaded and
No.
Yeah, for the past couple of months, and it seems like even the weather in Florida is pretty hot, and you are well hydrated. You cut down your salt dramatically, so that all reduce your blood pressure. So you get rid of lisinopril, but you still have beta blocker to help protect your heart, right?
Right. If 20 years ago, when I first went on lisinopril for a high blood pressure, I must have been diagnosed with a high blood pressure. How come over 20 years, now without medication, my blood pressure is in normal limits? What caused that change?
So there are many factors. First of all, your stress level is lowered, so you don't have constant high stress. That can help lower the blood pressure. Second of all, you think about the diet change, how much salt you cut down. That salt really help increase the blood pressure. Third of all, with the age, every 5-10 years, our blood vessel is not as elastic as before. So when we get older, our blood pressure tend to be lowered. So we don't need to lower our blood pressure with the same dosage of medication as before.
Mm-hmm.
So with the diet change, lifestyle changes, and age, the blood pressure should be adjusted accordingly.
Okay, I'll keep testing it and make sure